When our son was diagnosed with stage 4 cancer, we wanted to know everything science and experience has proven effective. What we found was a lot more than what we were presented with at the hospital. With so many well-trained, highly educated professionals operating outside the bounds of conventional medicine, it just doesn't make sense to limit ourselves when the stakes are this high. From interviews with world-renowned doctors and researchers to science-backed presentations given at medical conferences, when it comes to reversing or preventing cancer, this is where you come for the best of the best. I'm Ryan Sternagel of the Stern Method, and this is the Anti-Cancer Revolution. And welcome back to the Anti-Cancer Revolution podcast. Please excuse the break and any background noises. On that note, I instructed the kids to be quiet, but you know how that goes. I had imagined coming back right after the big last online conference, the Anti-Cancer Revolution 2, Evidence-Based Medicine, but there's just so much we're working to get set up and going, including a whole new show, which I'll tell you about after the interview today. This was the soonest we could get back to it, and it does feel very good to be back. I'm Ryan Sternagel of the Stern Method, of course, and today's guest is Dr. Tony Jimenez. Dr. Tony founded Hope for Cancer in 2000 and has dedicated his life to researching alternative strategies to treat cancer, chronic infections, and immune disorders. He is both an MD and an ND, is the pioneer of the holistic protocol approach, the 7 key principles of cancer therapy. And I was just telling my wife, Teddy, before I recorded this, if I was going to go to any clinic anywhere for cancer, I'd be hard-pressed to come up with somewhere I'd rather go than to go see Dr. Tony. Every time I talk to the guy, he just happens to be at a medical conference somewhere learning something new, which sadly is not terribly common in doctors, even those on the holistic side of the fence. Even when we recorded this show in the midst of lockdowns and all the rest of it, he was on a break from an online conference on the tumor microenvironment put on by Harvard or something like that. And it all really shows through in his work. We covered quite a few areas pertaining to cancer in this discussion, but if I had to sum it up, I'd say it's centered on light therapy. He's been using it since long before it was all the rage, so to speak. It answered quite a few questions I had on the topic, and I like to think it will for you as well. Dr. Tony Jimenez, thanks so much for coming on, and how are you today?
My pleasure. I'm doing excellent, Ryan. It's always good to be here with you.
Yeah, always good to see your face, hear your voice. I was just trying to remember, you were one of my, earliest integrative cancer heroes that I was getting a bunch of information from, found you right off the bat, right after our son was diagnosed. But it seems like I've known you forever, but I can't actually remember where we first met. Do you?
I don't, but we've seen each other in so many places, right? And more recently with your wife, and just telling the world, right, Ryan? What your son's journey was, and I commend you because of all the. I mean, you know more about cancer, specifically your sons, than many doctors do. So that is what would a parent not do to help their son, right? And you've done it.
Yeah, that's one of my biggest regrets, actually, for neuroblastoma in particular, is there's a lot up here. I'm pointing to my head for anyone just listening and not watching, but I never. Like this other guy that I know whose kid was diagnosed with cancer, he took a really, he had like a spreadsheet, and every different pathway he found, he marked it off. And, I, like I said, I had it all memorized for a long time and knew exactly what I needed to look for in terms of supplements and therapies and all that stuff. But, I just never documented it. And that's, every once in a while I'll get someone reaching out asking about, surely I must have all this stuff on neuroblastoma. And it's like, I could tell you a lot about it. I never wrote any of it down.
Well, that's one of those cancers that, in integrative medicine, oncology, which is what I do, and I've been doing this for over 30 years, we don't see much of it because they're children, and they typically go through the conventional route, as you well know. And however, I have seen a number of neuroblastomas, and it takes me back 2 years ago when I was called to help a little boy, Victor, who was 3.5 years old at the time. And he actually came to our Hope for Cancer Tijuana Center. And Victor lived to be well in his teens. However, ultimately, they say he passed away from side effects of the therapy he had when he was that little, but it was a remarkable, history and how he improved and was well, to the point that because of that, his there were other children that came to Hope for Cancer. One of them, Conan, from the UK, and he did really well. He's still alive, and it's been at least 15 years. And the reason I found out, because sometimes a patient just fall out off the radar,
Yeah.
and his grandparents who brought him to us wrote a book, The Kid with Neuroblastoma. I think you've seen that.
No, it was like the Amazing Cancer Kid or something like that.
That's
Yeah,
right.
we
Yeah, the
yeah,
amazing.
we we
Yeah.
found that one pretty early on too. I forgot that was you went to. Yeah.
Yes, yes. So it was all blessings because, and the that tells us that really treating cancer, Ryan, is fundamental in getting to the causes. And we describe that as the 10 hallmarks of cancer that were established even in the year 2000. Weinberg and Hanahan out of MIT and Stanford. And then in 2011, they came up with the final four, and now there's 10 hallmarks of cancer. And so when you work at that level, you're really getting to the mechanisms of cancer, which are inherent to all cancer types, whether it's neuroblastoma or pancreatic or stomach cancer. And that's really, it simplifies it a bit because it keeps us a little sane and knowing that there's a direction. Yes.
Yeah, no, I think it's funny you mentioned that. One of my interviews a while back, Dr. Greg Nye, he just put it so well that I was kind of just blown away how simple it was, and I hadn't thought of it in those terms before. But he said, the main difference between people on the just super conventional side versus anyone on the integrative alternative side of the fence that's kind of aware of what you just said is everyone on just again the total mainstream side is just looking at the differences between all these cancers and which specific pathway
Right.
is involved with this cancer and that cancer, and they're going after those specific pathways, whereas everyone clued into what you just said is looking at more of these these things that are common to all cancers, and what drives their metabolism, their growth, and their all that stuff, and going after that stuff, and then fine tuning with the different cancer types and pathways and stuff. I just found that I found that a really good explanation for like the
Yeah.
biggest difference of the two
And
different approaches.
right. And one of the things is that, there's so much diversity in tumors, not only between person A and person B, but within a person. So let's say they have a primary tumor of the colon, prostate, breast, lung, wherever, and then that metastasizes somewhere. That tumor is diversely dissimilar in the primary mother tumor, if you will. And so these tumors have, Ryan, what's called driver mutations. And a driver mutation is a mutation that makes that tumor develop and progress and makes it more resistant to specific therapies. So when we're doing what you just mentioned, like targeted therapy or blocking this receptor, we're focusing on those specific driver mutations. But a tumor can have up to 50 driver mutations, if not more. So you might have a temporary benefit in seeing tumor reduction and maybe putting someone in remission. But ultimately, these other driver mutations are going to kick in, and that's when you have a more aggressive, progressive disease. This is what the head of Stanford Oncology in California says, that there's stupid cancers and there's smart cancers. But stupid cancers is only 1% of all cancers, right? Because they have one single driver mutation. So you block that one and the patient does really well. But guess what? 99% of the cancers are smart cancers with multiple driver mutations. They develop resistance quickly to conventional therapy. And so it's a tough challenge when you are focusing or just targeting one of these, pathways.
Yeah, it's interesting you bring that up. My son's regular conventional oncologist. He's involved in, I forget what it is now exactly, but it was some sort of mapping the genome type mapping a, maybe mapping the genome of neuroblastoma and all the different, mutations and everything associated with it. And it seemed pretty impressive just when I was reading about it. And then you watch the little video about the project, and of course it makes it looks like it's going to yield a 100% cure right around the corner and all this stuff. And then I actually asked him about it, and it's like, we still have no way of finding out, like, what the driver mutations are or how many driver mutations there are. It's a long ways to go. And yes, that video is way too optimistic.
Yes. But I'm glad someone is doing that work, because it does occasionally bring us some information that allows us to think more. And but what it has allowed me to do throughout the years, Ryan, is say, wow, we are on the right track, right? Because we're seeing cancer as a systemic disease and not as a local, pathway. And that's where the success ultimately is.
Yeah. And you had mentioned stupid cancers versus smart cancers. That's something I actually wanted to ask you about, and I'll go ahead and plug your books so you don't have to. There's highlighter all over it. Yeah, I would highly encourage anyone to get Hope for Cancer: 7 Principles to Remove Fear and Empower Your Healing Journey by Antonio Jimenez, MD, ND. It's really good. Yeah, yeah. The breadth of your study is very well elucidated in there, and anyone can get a whole lot of stuff to look for at a clinic, but it's mostly stuff that people can implement in their own lives right now. It's a really good blend of both. But anyway, that's I was giving everyone a little preface for I had read it a while back. There's highlighter all over it, and I just had picked out a bunch of random stuff that I wanted to ask you about for it. It's going to be real hard to title this interview and the main bullet points of it, because I think it's going to be all over the place, but that'll be one of the good ones. Maybe those are the best kind of interviews.
Well, if
But
I
no,
could say one thing, Ryan, because
please do.
you might have some viewers and listeners that say, "Hey, wait, I don't have cancer. Why is this important for me?" And the importance is that these 7 key principles that you just read in the title of the book, 6 of them apply to all of us. What if today, not tomorrow or in a month or in a year, we start applying these 6 principles, 6 out of 7, to decrease our risk of developing cancer, and for that matter, most chronic diseases? Wow, that would be a major accomplishment, because according to some research, they say by 2030, everyone in the US will have cancer sometime in their lifetime. So, information like this that you're providing to so many people, Ryan, is can make a difference, and will make a difference if we act now.
I was not aware of that. When I say they, I guess you're talking NCI or somebody like that, but they're saying by 2030, it's going to go up to virtually 100%.
Virtue 100% if people live long enough, which, science and medicine is really good now at allowing us to live longer, right? But yeah, everybody. And now with so much more things happening in our environment. And, the subtitle of this book is interesting, right? 7 Principles to Remove Fear. Especially now in 2020, this is one of the most common factors now, is that everybody's in fear,
Yeah.
for many reasons, right? And empower your healing journey. So I like to emphasize that, right? We have to go away from fear into faith and empower our own healing journey, because if we don't, not so many other people will help us do that.
Whenever someone gets mad at me at the grocery store for not wearing a mask, I just tell them they should be, doing rectal ozone insufflations every day, and maybe they won't be so scared either.
That's right. That's
On that note, I don't have the 7 principles memorized or listed out. Do you want to run through them real quick? Because I just have a bunch of random questions that don't really follow any rhyme or reason.
Okay, surely. Number 1, and these are not in any order of importance, because there's 7 principles, because they're all important aspects. And number 1 is non-toxic cancer therapies. And of course, that's the only one out of the 7 that apply to those of you with cancer. So that's non-toxic cancer therapies. Number 2 is the immune system. And more so than ever now in 2020. We know how important the immune system is, not only to protect us from cancer, but pathogens, virus, bacteria, parasites, and everything else. So the immune system, and in cancer, Ryan, it's not only important to have an optimal immune system, but an immune system that can see the cancer cells, because that's one of the characteristics of cancer. It's its ability to hide or shield themselves from being seen by the immune system. So we have to have an optimal immune system that is able to see viruses, able to see the cancer cells. The third key principle will be nutrition, and that's a big topic, right? Nutrition as a foundation to health. And one thing I like to say about nutrition is it's not only what we eat, but what we assimilate, what we digest and metabolize, and ultimately what we eliminate. So we need to see nutrition in that aspect. It's not just going to Whole Foods and spending thousands of dollars on, non-GMO and organic this and that, but how well are we assimilating that? How well are we absorbing, digesting it, and then how are the bowel movements, right? And so, nutrition, the next key principle is the gut microbiome. And that is just one of many microbiomes because our mouth is a microbiome. Actually, this morning I went to a biological dentist for a checkup and a reassessment. And so it's always important to assess the mouth microbiome, the mouth dental, oral hygiene, and health. And one of the things he did today is they take a little sample of each quadrant and then look at it under the microscope. And they rate it from 1 to 4, meaning 1 is no pathogen, especially spirochetes. Spirochetes are really bad bugs because they go into the heart, they go into the lungs and cause a big set of problems. And so fortunately, I got an A+. He said, "Oh, you have a boring slide." And why is that? Because I'm doing oral rinse. I'm making my own mouthwash, right? I am flossing. I am using a water pick with xylitol to clear up those bacteria in your mouth. So it pays off, it really does. So the microbiome, and then don't forget about the external microbiome, that what we're exposed to. So that's the other key principle, the microbiome. And then we talk about the emotional and spiritual aspect of health and disease. And actually, that's the title of my second book, which will be out the beginning of next year, Emotions in Cancer. And that's done. We're just working on the illustrations and images and things like that. But the emotional plays such a huge role in everything, in health and disease. Now with this viral thing going on, we need to emotionally be as sound as possible. And then the next key principle is the oxygenation, right? We know that disease, specifically cancer, it won't thrive in a highly oxygenated environment, such as pathogens either. And then the last one is detoxification. And that starts from what I've been quoted as saying years ago is that a negative thought can kill you faster than a bad germ. So we have to detox our emotions, our thoughts, our negativity, and our humanness sometimes, if that's a word, in addition to heavy metals and stuff going on in the mouth. So those 7 key principles really, after so many years in working in oncology, over 30 years, I'm sure that form the foundation of our health and our recovery for those of you with cancer.
Yeah, I forgot you're going to be doing a basically one book for each of those 7 key principles, more of a deep dive into each one, right?
Exactly,
Yeah.
exactly. And actually, the third one is done also, but that won't be out till the end of next year, and that's on nutrition and cancer. So yeah, that's the goal, Ryan. Because the more people that are educated, now we have our first book in Japanese, so that's helping people over there in Asia. So thank you for helping me spread the word.
Yeah, I was just going to say we'll have to make a little tradition every time you come out with a new one. That'll be good.
Okay, sounds good.
this is kind of an odd place to start, but it might have even been in your introduction before you launched into the 7 key principles. But you talked about supernatural healing miracles. And, how folks shouldn't give up hope even when they're told that it's the darkest of hours. And I would agree, just even from a just from an integrative perspective, there's always, you always hear about somebody that found the right combination of things at the last minute and completely turned everything around. But yeah, I don't know. You mentioned you've heard so many different examples of just crazy remissions. I was hoping you might expound on that a little bit.
Yeah, not only have I heard them, Ryan, I witnessed them, and I do mention some in my book. And preface to that is, independently of what your religion is, I believe, of course, in Jesus Christ as our Savior. There's a higher being. There's a divine order to things, and I know for a fact that anyone that comes to Hope for Cancer comes to see myself and my group is there for a reason. And so we start every day with prayer, and we end the day with prayer at the centers. And what can be better than when your mind, your soul, and your spirit are aligned? That's where the miracles happen, right? Because we know that the spirit is incorruptible, because that's the spirit of God. The soul and the mind and the body, well, that's a different story. That's where disease happens, right? And so working at these levels is where we see these profound changes and remissions and cures, if we want to use that word. And it's, as a medical doctor, oftentimes I'm saying, how could this patient improve? I mean, they have metastasis on the metastasis, right? It's so difficult, and they do. Some of them do. The least that could happen is that they have significant improvement in quality of life. So let me tell you one story to answer your question and to illustrate it really nicely. I remember we had a patient from Minneapolis, St. Paul area, and he was a pastor of a big church, mega church there. So he came to us with stage 4 prostate cancer, metastasis to the bones, to the lymph nodes, and they flew him in a private jet to San Diego. We picked him up, brought him to the clinic. And the first day, we did all the studies, the blood work, the ultrasound. And I saw him on the second day. And when I went to review all his records and results, they didn't match what he brought and what we found. For example, the marker for prostate cancer, the PSA, was normal, it was below 4. And the ultrasound didn't show any lymph nodes. And basically, there was no cancer in the studies that we did. So then I told them, let's go deeper. Let's do an MRI, and let's do a bone scan to verify what's happening in the bones. And surely, after a few days, got the test results back, and everything was clear, Ryan. No bone metastasis, no lymph node activity, prostate was healthy, PSA normal. And so he asked me, well, what could this mean? I said, well, you're the minister, you're the pastor of a big church. I think you had a miraculous healing. God healed you on the way to Hope for Cancer. And so he said, well, what do we do now? I said, well, go home. There's nothing to treat. So
Hang out and get a couple IVs.
yeah, exactly. Give us some recommendations in nutrition and lifestyle changes and things like that. And so he went back home. And that same week, he called me from his urologist's office. And the urologist said, I don't believe this. These tests are from Mexico, and they're wrong because we diagnosed you. And we've been looking after you for X number of months or up to a year. And so they wanted to run all the tests again, the MRI, the bone scan. And, Ryan, these are the same machines everywhere, whether they're made by GE or Samsung or whomever, they're the same machine. And so I told the patient, well, I mean, you don't have to because we did it, but it's up to you. So he went ahead and did it. And of course, the results were negative, right? They were the same. And that points to the fact that anyone watching or anyone that has been given that diagnosis of, you're terminal. First of all, we're all terminal, right? And so don't take the word of that doctor with all these diplomas and the white coat, because miracles do happen, and it begins in the mind. Even though this pastor didn't believe, finally he believed that yes, there is a divine being. There can be healing like this, and oftentimes I wonder, Ryan, why some patients heal and others don't, and they have a similar diagnosis. We're doing, a similar treatment, of course, tailor made to each one. But it's given me more gray hair in the last 10 years than ever. Why? And it comes down to the mindset, and that, the belief of uh, evidence versus truth, right? Because oftentimes this doesn't correlate with each other. Because someone has bone metastasis doesn't mean that they cannot heal. And so for the viewers, my recommendation, after 30 plus years of working in oncology, is that you, no matter what situation there is, whether we call it miraculous healing, whether we call it spontaneous healing or radical remission, you can heal. And this is just one example of many that I've seen throughout the years.
Yeah, the mindset's a big deal on two fronts.
Mm.
I I hear that a lot from people. That's the one difference that made the difference, I guess, in people that made it. And you hear, I mean, just from a biological standpoint, it makes a lot of sense because if you accept the fact that your thoughts can influence your epigenetics and things of that regard, then supernatural or not, you're you know
Yeah.
you're doing some good to your body. But then there's the work of people like what's her name, Dr. Elizabeth Targ, I think, who did all that research on the power of intention, and people who got prayed for even when they don't know that they were getting prayed for still have better outcomes from surgery recovery and all sorts of stuff. So it's like, and then yeah, so I don't know, it's a big thing, the mind, that's for
That,
sure.
yeah, that was actually a published study where they had two groups of cancer patients, a significant size group. I think it was like 1,000 cancer patients or so in each group. One group was prayed for by all denominations, Jewish, Christians, Muslims, whomever, and the other group wasn't prayed for. And there was a statistically significant improvement in the patients that were prayed for versus the ones that weren't prayed for. So, and that was a published study. One of the things that we know is that cells are communicating. There are these so-called information pathways, and as you know, one of the biggest studies that have been done and research is something called the RAS protein, RAS, and this is a protein that transmits signals within cells. It's also called a cellular signal transduction pathway. And so what that means is that when these RAS proteins are mutated, then cancer cells can grow uncontrollably and evade the immune system. So imagine if we're given these negative thoughts and these fear-based thoughts, these information pathways are going to affect these genes and proteins. And as you said, the epigenetics will have such a factor that biologically and physically it kicks in. And so, we have that power. Of course, we have to do physical treatments, and it's a combination of many things. But overall, the predominant thing that I've noticed in those that heal versus those that don't, it's not usually the physical therapies or the treatments, the IVs and things like that. It's the mindset.
Yeah, yeah, and just all this stuff that you hear about really just goes towards the notion that this is an energetic reality. And like Ryder, my son, says now, it's we all share the same energy. And he gets a kick out of like asking really practical questions to that about, is he connected to his fish and all this stuff. um, but yeah, yeah, no, and that, and that goes to, I guess that's kind of a rough transition into what I wanted to ask you about going forward for a few questions here is, light therapy has caught on the last couple of years, shall we say, and now there's a million different red light therapy manufacturers, and there's the Weber laser system coming out, and you can go get a laser IV. I think you actually do that yourself, and I wanted to ask you about that as a follow-up question. But you've been what I guess you can call kind of a pioneer in light therapy, and you've been yeah, talking about your sono photodynamic therapy for quite some time. So I have several questions for them. I've been dying to ask you around light, but could you start by just describing the sono photodynamic therapy and maybe how it's evolved a little bit over the years and exactly what it is now?
Absolutely, absolutely, Ryan. And first, we know that, we cannot live without light. We know that, biblically, we know that physiologically. Just one example is vitamin D, right? I mean, one of the most studied vitamins and all the metabolic pathways and the importance of light to have optimal vitamin D levels. So, light and then sound. First was the word, right? If we go back to the Bible. And so when we use sonophoto, we're using sound and light. And I believe this is at the root of humanity, the root of our, our creation. And so to go forward, there's a lot of work that has been done in Russia and China, dating back to the early 1900s on photodynamic therapy, specifically using light. And as you know, the light spectrum, the rainbow, the sun, I mean, there's something to all of this. So, as you said, now we're able to use light all the way from the ultraviolet light to the near infrared. And that means blue, yellow, green, red, infrared. And each of them has their benefits. For example, blue light, and now in the era of the COVID, blue laser light is a good antimicrobial. It also increases nitric oxide production, very important for health of the cells. And when we get to the green light, just think of the garden, right? It's a more soothing, more relaxing type of light. And the green light is very effective against depression, anxiety, fear, all these things. And because green oxygenates, when one uses green light, we're increasing oxygen stores. And you know that cancer cells don't like oxygen for the most part, right? They're mostly anaerobic. So that's like a general breakdown of the light, and the sound is it penetrates deeper, because if you have a flashlight and you put that flashlight on one side of the door, it's not you're not going to see the light on the other sound on the other side. So light has a depth of penetration limitation. It doesn't penetrate as deep. So when we're focusing light therapy, let's say to affect the liver tumor externally, the light, that's not going to be very easy. But sound, right? If we're on one side of the door and we speak, you could hear it in the room inside, right? Sound penetrates deeper, and sound travels very well in water. And remember, we're about 70, 75% water. And so when we use sound therapy, we could deliver those frequencies and resonance of sound and and penetrate deep into deep tissue. And so that's important when we combine the sound and the light, because then we could affect deep tissue, deep tumors, as well as superficial. And basically, to go to the premise of all this, is that the person takes a substance that's non toxic, it's called a sensitizer. And this is given either sublingually, we could give it intravenously. We could give it directly into a tumor or around a tumor. And then we wait X amount of time for cancer cells to absorb this substance, which is non toxic, called a sensitizer. And the studies show that cancer cells preferentially uptake this substance, meaning that cancer cells have an affinity for this, whereas normal cells do not like it. And within 24 hours, normal cells will even eliminate it. Why this happened, it's not so well deciphered yet, but that's what research has shown. But this substance, Ryan, by itself, it does nothing. It's not active until it's exposed to sound and light of specific frequency and wavelength. And when you do that, then that substance wakes up, if you will, and releases ROS. Remember that word, reactive oxygen species, right? That is toxic to cancer cells. And in addition to that, you're going to upregulate both ends of the immune system, the quick acting immune system and the long term immune system. And then Dr. Burke at Harvard, prior to his passing, he found that photodynamic therapy, the use of light, affects microbes as well, like bacteria, fungus, and viruses. So remember, oftentimes pathogens are associated with cancer, HPV, right? Human papillomavirus, cancers of the head and neck or the genital organs, herpes, cytomegalovirus, Epstein-Barr virus associated with lymphomas, and H. pylori, that bacteria associated with esophagus and stomach cancer. So cancer almost always has a microbial component. And with sonophotodynamic therapy, we get that added benefit that we can and do get rid of some of these pathogens, if not all of them. Of course, you're giving other additional therapies like IV vitamin C and ozone that also has effect on killing these pathogens. So it's quite a unique therapy. And the other benefit, which is very important, Ryan, is the ability of sonophotodynamic therapy to decrease the blood supply. That's called angiogenesis to the tumor or the lymph nodes, because cancer cells are like bullies and they need a lot of energy, they need a lot of nutrients, and they need to eliminate waste. So if you cut that blood supply, shut off the windows and the doors, and stuff cannot come in or leave, that cell is going to suffer necrosis or apoptosis, which is cell death, which is lacking in cancer cells, right? So sonophotodynamic therapy is quite a unique therapy, as you said correctly. We've been the pioneers. I've been, talking about this since 2000 when we first opened our Hope for Cancer treatment centers in Tijuana. And I'm so happy that you, nicely recognize that it is now more known and more people are talking about it. I know when I first brought up the topic about near infrared saunas, and then now that was in 2014, I believe, in one of the Truth About Cancer's documentary. And then after that, it's like everybody is doing near infrared sauna, which is another light therapy, eh, light
Yep.
and heat therapy. Yes.
Yeah, no, definitely want to ask you about that too. So the sensitizing agent, that's a chlorophyll derivative or something like that?
Yes, it's a chlorophyll extract. You could get it from seaweed as well or from chlorophyll. And now what we're finding out together with other researchers is that that's one extract that we could get from chlorophyll and or seaweed, but other substances also act as sensitizers. For example, vitamin C, because if you look at the spectrophotometry of any substance or all substances, they have a peak where they can be awakened or activated. And vitamin C is in the red light spectrum, like 660 nanometers to about 680 nanometer. And guess what, Ryan? Chemotherapies also have a light activation spectrum. So let's say cyclophosphamide, Cytoxan, or 5-FU, there is a wavelength where it can be further activated. And I say this because, we're medical doctors, we do integrative medicine, and some patients come to our centers with huge tumors. And so we have to integrate often, not oftentimes, but sometimes IPT, low dose chemo. So what do we do? In addition to getting the chemo effect of that chemo drug, at the same time, we're doing the intravenous lasers of that particular color wavelength. So you're having sort of like a double whammy benefit, right? The chemo effect and the photoactivation of that substance as well. And then there's things like hypericum, which is also has a photosensitizer effect. Curcumin is in the blue spectrum, right? So see, we use light depending on what substance the patient is getting, and it's beautiful because you see other benefits. Light is just healing. And what do we say, right, Ryan? When there's light, there cannot be darkness, and patients are happier, they sleep better, they're more hopeful, and this goes a long way in their recovery.
So that's really interesting though, that that the sound component reacts to the sensitizer in the, well, it's the same sensitizer that reacts to
Yes.
both the sound and the light. Do you have any guess as to why that? I mean, it's just vibration and it's reacting to both of those elements?
Yes, the sound component we use exclusively with the chlorophyll-derived sensitizer.
Yeah.
This have not found yet that sound will activate vitamin C or others. Those are more with light. But with the chlorine E6, which is the main sensitizer that we do, these studies were done in animal studies in China, where they used the sound and they found out specifically, Ryan, what intensity of the sound, what frequency of the sound, and wavelength. And so we know that now, but based on the studies that were done in China, so we use them with our patients as well. Obviously, we accommodate for the difference in weight and so forth from an animal, right, a rat to a human. So all those have been extrapolated and deciphered very nicely for a human adult.
And yeah, and it's funny, like with all this stuff now, because yeah, we got the Weber little laser watch deal and the red light therapy, and so now I'm timing, you timing all this stuff with my son, and like, okay, take the vitamin C, and then wait 20 minutes, and then we'll go hit the light and all this stuff, and and then that was an additional. I think I got a while back. I forget the guy's name. He has a clinic in Germany. It's not going to come to me right now, but he was telling me that he does IVs in the in the sauna, or while he's administering hypothermia, because then cancer cells are at their weakest, that sort of thing. And so yeah, this just added a whole new element of like timing, because I had Ryder like taking liposomal supplements inside the sauna, just doing whatever we can to recreate
Yeah,
everything.
right. They
Yeah.
have synergistic effects, and then you could shorten the time that people are doing therapies because you have to have life also, especially after they leave the center and they go back home and continue in therapy at home. Some of these patients have 2, 3, 4 hours of therapy a day, plus they have to make their food, their juicing, the coffee enema, all this. So we need to figure out how to maximize their time so that they could live. And I know that's been something that you've worked at a lot with Ryder, right? Because I mean, there's the other kids and there's the wife, there's work, and so. But yeah, the synergistic effects of these therapies, the timing can be very, very important.
Yeah, well, fortunately now he's with the other kids. Now he's of the age where you can just say, "Hey, Ryder, have you gotten in the sauna yet today?" "Oh no, all right, I'll go do that." And he hops in there and doesn't even need me anymore. So that helps.
I hope he could continue to be an example for others, right? Because we all should be doing some of these things for
Yep.
prevention. And that's the beauty, as I mentioned earlier, on the 7 key principles that I discussed, 6 of them pertain to all of us. And I like to repeat this because I wanted to, resonate with everyone, no pun intended, but the 6 principles are very important, to all of us to decrease the risk of developing cancer and any other chronic disease for that matter.
Yeah, I mean, even the occasional non-toxic cancer treatment's probably not a bad idea for everyone from a prevention standpoint either. That's for
That's
sure.
right. That's correct. Yes, yes.
The sound component, what type of device is that? Is that just an iPod and a speaker with a special track on it, or what are you using?
Well, we have to make sure we have the exact intensity to the sensitizer we're using and the wavelength and duration. And then we need to have a probe that has enough surface area that will be in contact with the area that you want to treat or in its proximity. So it is a medical device. That being said, it's very safe. Since the year 2000, patients have been doing this at home. And yes, you heard me correctly. You know, they're taught how to use this at the clinic, and it fits in a little, even like a carry-on, and you'll have extra space for other things. So it's portable. Patients that go on trips or on cruises, they take them with them, and it's also a therapy, Ryan, that they like because it feels good. The probe head, it's a little bit warm, so that's soothing. They feel the sound energy penetrating. I must say though, sometimes it can cause a little pain or some pain in the tumor area. And we teach patients that this is not necessarily a bad thing. You know, we're affecting that tumor, especially if there's inflammation and other things. So, we always are making adjustments to this. It's not just do this for a year and that's it, right? We're modulating it as we go on. But it is portable and it is a medical device though.
Good deal. And then with the light, or is that I whenever I see pictures, it's just red. Are you using is the photo component of sonophotodynamic therapy, is that primarily red light, or are you using the full light spectrum? And then second question is, I know you also utilize the I think when you talk about PDT plus in the book, that's essentially the Weber laser system, correct? And if so, how do the two complement each other?
Right. So the reason we use, and you see a lot of pictures of red light, is because historically that was the light that we had. And it's used for that chlorophyll derived sensitizer called chlorine E6, which by far, even with other sensitizers that have come out, the chlorine E6 by far is the most effective and best absorbed by cancer cells. So that uses the red light. And so you'll see that when we speak of sonophotodynamic therapy, we are talking about the chlorine E6 with the red light. When we talk about PDT plus, now we're doing photodynamic therapy. That's what the PDT stands for, plus, which means now we will integrate the other color lights, the ultraviolet, the green, the yellow, the blue, and the near infrared. And that we can do intravenously, as you mentioned. And by the way, before I did this on patients at our centers, I was the first one. I said, I need to know how it feels and, test it
Yep.
out on me. Isn't that nice when, doctors and practitioners will do something on themselves that they give their patients, right? Yeah, so that's one way of using these additional lights intravenously. We could do it now at the Tijuana Center, Ryan, for those patients with esophagus or stomach cancer. What we're doing is we're doing the sensitizer intravenously. We wait 3 hours for maximum absorption and accumulation in the esophagus or stomach cancer tumor. And then the GI doctor goes in with an endoscope, locates the area of the tumor, and then we put in a fiber optic laser, in this case, red, because we're using the chlorine E6, and we're targeting directly that tumor. And oftentimes we see up to like 46% reduction in tumor size with one therapy. We have a number of patients now that have done two, A couple are slated for a third therapy. We could do this into the bladder. We did just recently a patient with a rectal tumor that was about 10 centimeters from the anus, so very accessible. And so in the future, there's other areas that we can do this therapy into. But remember, these are localized therapies, but always in the context of treating the whole body, because cancer is never, I can say never, never a local disease. It's always a systemic dysfunction or dysregulation that must be treated, even if PET scans, CAT scan, MRI just show one tumor somewhere.
Yep.
So, so this is the beauty of these lights. And like I said, we could go into tumors, we could go around the tumor, and technology. To further answer your question, technology has just increased, and the Weber laser is one of those. Technologies that have increased. I know we've used technology from Russia when we started. Then NASA, out of the NASA work, we were using a red laser at one time. And now in 2020, well, the latest advances are the Weber lasers. And also working with some of my colleagues in Germany, we're using a 4-channel, very powerful 4-watt laser, in this case red, that has just an extreme ability to affect tumors very selectively without damaging surrounding tissues.
Yeah, the endoscopy thing is really interesting. The event we just did, the Anti-Cancer Revolution 2, Dr. Sharon Gurm gave a really, yeah, I didn't know. I didn't know it was that's the first time I heard of endoscopies and shoving lasers inside of people to get the deep tumors and all that. But yeah, she's sure getting great results with it and combining it with hyperthermia and all this stuff. And yeah, it's amazing. Here's a question I had for you. So when you're talking about the PDT plus and the lasers in the book, you mentioned that it is good for destroying circulating tumor cells, but then you also mentioned that it's not good for blood cancers, or maybe not as effective for blood cancers. I would
Yeah.
think, that if it's killing a circulating tumor cell, then why wouldn't it be able to kill just a regular blood cancer cell? But what's the difference there?
Well, that's a very tough question. First of all, because when someone has leukemia, and we call that a blood cancer, it's not like a tumor cell. It's
Mm.
it's cells that are abnormal per se, right? And so it's a different functionality. We don't believe that these abnormal cells, like in leukemia, are absorbing the sensitizer. And so that's a big part of it, because it's not a tumor per se. It's these blood cancers of, it's like having uh, a, a cell that didn't become an adult. It's like a premature cell, right? And so it's still lacking its functionality, and we have just not have seen results with it.
Fair enough. Fair enough. All right. Near infrared. There is a bit of, yeah, when you talk about near infrared versus far infrared versus red, yeah, it depends on who you talk to, you get a different story. I think the two primary concerns that people bring up with near infrared and cancer, um, if my surmising of the situation is correct, is that one, it could, it's near infrared is particularly good for mitochondria. So therefore, maybe it would stimulate cancer cell mitochondria and make it more active, aggressive, that sort of thing. And then two, it's also been shown to increase blood flow. So who's to say that it would not increase angiogenesis? Obviously, you've been seeing great results with it. So, but I don't know what made you choose near infrared over far in the first place, and then yeah, what do you say to those concerns?
Well, that goes back a number of years ago when I was studying William Kelly's protocols. Remember the enzyme protocol, William Kelly, and then Dr. Gonzalez, Nicholas Gonzalez, who used the enzyme program. And then I met a lady by the name of Pamela McDougall, and she was one of the last students of Dr. William Kelly, who cured himself of pancreatic cancer using enzyme therapy. And so that's the trophoblastic idea of cancer, that a cancer cell looks like a pregnancy, right? And so at some time, the the embryo stops dividing as quickly, and then the fetus forms and it's a controlled growth. Whereas the cancer cells doesn't have uh, that mechanism to stop that uncontrolled growth. That's the difference. And Dr. Kelly found that it was an enzyme that was produced in a pathway there that stopped that excessive growth in the embryo and to lead to a fetus. And so back then, when we were studying all this with these people doing the Kelly program, near infrared sauna was what was being used for detoxification, for improving. When you say that it improves blood flow, it does, but mainly the micro vessels. And that's the very tiny vessels where vascular disease starts. When someone has a coronary problem or blood flow insufficiency, that's a late stage of a microvascular disease process, the very small vessels. So with near infrared sauna, you are mainly reestablishing the microvessels of healthy cells. Remember that a healthy cell versus a normal cell, versus a cancer cell, the blood supply and the angiogenesis is totally different. In a cancer cell, you're going to have leaky vessels. They're called leaky vessels. You're going to have something called increased or high interstitial fluid pressure, which you don't have in a normal uh, blood vessel in a normal tissue. So there are anatomical differences, Ryan, in a cancer cell versus a normal cell. And so when you are giving near infrared sauna, you're not going to affect that chaotic blood supply in a way that will promote cancer growth of a cancer cell, because it already has a high interstitial fluid pressure, it's leaky, it's aberrant, and it's chaotic. But a normal blood flow situation, that's what's going to benefit from things like near infrared sauna and the detox. And near infrared sauna is more like a physiological. It's like when our cells receive near infrared sauna, it's like, ah, I recognize that. It's the wavelength and the frequency. It's like it's it's what we know. It's like when we stand by the sun, the near infrared light is one that the body absorbs mostly and ideally. The other point here is that we have whatever light we're doing, far infrared, near infrared, we have to be careful about electromagnetic fields emission. And now the far infrared group has improved their technology. But back when we started, these far infrared machines, they were emitting a lot of EMFs, where the near infrared are very low EMF producers. That was another benefit. And then there's a book called Sauna and Detoxification. I forget the doctor's name. Oh, Lawrence Wilson. Dr. Lawrence Wilson wrote a brilliant book called Sauna and Detoxification. And that was sort of like my mini Bible, per se, of a lot of what I learned with respect to near infrared sauna and the benefits of near infrared sauna for cardiovascular disease, for also chelating. Near infrared light is a better chelator to grab onto heavy metals and help the body eliminate it than far infrared. And that's just work that has been done, Ryan. It's publications, it's not something that I made up, but that I've discovered throughout the years. And as you said, and the results, that we have. Obviously, you can't say, "Oh, it's the near infrared sauna," right?
It's just that, yeah.
Yeah.
And then I mean, if you just want to say ditto to everything you just said, but where does now that red light therapy is becoming popular and there's these red light devices. Well, most of the red light devices now have just plain red, and then maybe combo with near infrared as well. Is it? I don't know. The same thing you just said, pretty much in terms of the red, or is there?
Well, pretty much. However, we use the red light more for targeted therapy when we use that sensitizer, right?
Okay.
660 to 680 nanometer. So we use the red light to activate the sensitizer, but we don't use red light as a systemic therapy like we do the near infrared light.
So if I get my far infrared sauna and take my red slash near infrared light panel in there, I should be good to go then.
Yeah, or you could convert your far infrared into near infrared, right?
Could I? I don't know.
Yeah, yeah, we could give you that information of how to do that. Yeah,
All right.
it's not very complicated. You'll have more health benefits.
Love it. Well, I'll have to follow up with you on that. Maybe, yeah, actually, maybe I will bug you about that, and we'll put it in the show notes to this episode. That'll be good.
Okay.
Last light related question. Talk about photodynamic infrared spectros spectroscopy.
Yeah,
Spectroscopy.
yeah. Well, that's what we call PDIS, and this technology was developed, photodynamic infrared spectroscopy was developed in Germany.
Spectroscopy.
Spectroscopy developed in Germany, of all places. You could have guessed that, right? And it was a brilliant development uh, at Paderborn University in Germany by Dr. Shikora. And then I was introduced to it by Dr. Weber in one of his conferences up there in Germany. And then he had some, evidence and brought in the scientists and all that. So we used to use the PDIS to target circulating tumor cells, CTC, cancer stem cells. And we thought that this was, the next best thing coming up in the development of cancer treatments and diagnosing or detecting circulating tumor cells. However, in my experience of over 6 months, I found that the calibration was not very accurate. And unfortunately, Ryan, this technology has more work to be done. Dr. Weber is working on it. We believe in the science, we believe in the technology. It's just not there yet. Not there yet. Uh, we do use it in select tumors that are more external to see, because with the spectroscopy, what we can also see is if the tumor absorbed the sensitizer. This is a little segue of a different use of the PDIS, but it's useful in external tumors to see if the absorption of the sensitizer happened. Because as a Chinese scientist once told me, Dr. Tony, sonophotodynamic therapy must work. The limiting factor is, did the tumor absorb the sensitizer? Let's say a patient has, several tumors or many tumors in different parts of the body. How do we know if each tumor absorbed the sensitizer so that we could activate it, wake it up, and destroy that tumor? There isn't like a scan or a wand that you could just and scan. Oh, it didn't hit this tumor. It wasn't absorbed by this tumor, but it was by this. So that doesn't exist yet. And this is why always in medicine, even with chemo, you don't know if the chemo is going to be absorbed by each cancer cell or all the tumors. So this is a challenge in oncology, no matter if it's radiation, chemo, or natural therapies, right? How can you know if that tumor, those cancer cells absorb whatever it is that you gave, right? The chemo, the radiation, the vitamin C, the poly MBA, the pal, the this, the that. You don't know. And this is why you're using a combination. So with the PDIS in external tumors, we can know if the sensitizer was absorbed. So for now, in summary of your question, Ryan, is that PDIS, photodynamic infrared spectroscopy, to detect circulating tumor cells and or kill the circulating tumor cells. That's a bit on hold now till they fine tune the calibration so that we have more, reliable results in the treatments.
Very good. Good to know. Yeah, that kind of blew my mind when I was reading about it, but
Yeah,
I guess
yeah,
a little ahead of its time, but sounds like it's
yeah,
on its way.
exactly. Yes.
What other tests are kind of your go-tos as far as monitoring? I mean, I'm sure you could list off a whole blood panel, but you talk about cancer profile in the book.
Yeah.
Um, yeah, I don't know. Do you have any preferred like CTC tests outside of the spectroscopy, or what are you using to monitor progress?
Yeah, I'm not very convinced yet of all the CTC testing that's out there, whether it's Cell Search, whether it's RGCC and others that exist. Um, Mostly we're basing our work on clinical observation and how the patient is doing clinically. The tumor markers, whether it's this PSA, the CA15-3 or 2729 for breast cancers. And then of course the ultrasound to see blood flow in the tumor, size and location, and then MRIs and thermographies also can give us some good data, right? So it's a combination of all this data points and patient's weight. Let's not forget that we have to be clinicians. Blood tests and all these are good and necessary, but we have to touch the patient. We have to see the patient. We have to listen to the patient. And this is medicine healing 101 that is being lost, every day more and more with specialized medicine and, 5 minutes with a patient and that's it kind of scenario in some circumstances, right, with insurances and health systems.
Yeah, it's a good thing to keep in mind that the natural side is always saying that the conventional side isn't really treating the patient; they're just treating their bedside sheet and just following a protocol and that sort of thing. And now with all these fancy different tests on our side, you could start to say the same thing. That's it's good to keep in mind. There's nothing, no substitute for just in person, just getting the feel for how everything's going and being a clinician, like you said. Something good to keep in mind. I have a smattering of other questions here. GC math is something that again is kind of, you ask different people, you get different answers. I just interviewed the immunologist AJ Lanigan, who of course has his own favorite immune enhancing or modulating product. But I asked him about GC math, and yeah, he wasn't a big fan. He said something to the effect of it's an artificial stimulation of the immune system versus something completely natural, and it's never been tested on a large group of people. So how do you really know that it's beneficial? But at least in the book, you're still pretty hot on it. I don't know what do you have to say to the naysayers on GC math?
Well, I know AJ and I respect him highly, and I think beta D glucan is a beautiful product. It's part of our toolbox, and so props to that. So GC-MAF, that stands for macrophage activation factor, and macrophages are very important cells of the immune system. They're actually in every tissue of our body. And basically, they're surveillance cells that are waiting to be called to action to kill pathogens, bacteria, viruses, and or cancer cells. But what happens, and this is very well studied, cancer cells are able to suppress macrophage mobilization from tissue to the cancer cells. And so with this external product that comes from sources like colostrum and human sources or animal, they've extracted these macrophage activation factors that are non-toxic. And most of the studies were done in Japan. And it's been quite controversial. It was also used in England. There's a lab in Belgium and Australia, I'm sorry, Austria, that also we can source GC map from. But we've been using it, Ryan, for a number of years. I take oral GC map myself. And There's no side effects. I truly know that from an immune perspective, these macrophages are very important, and we don't see side effects. I've been to conferences. I chaired one conference in Osaka, Japan, where there were international physicians using GC-MAF. And remember, this is not a cancer therapy per se, it's an immune therapy. And so they were using GC-MAF and other pathologies, including psoriasis, which is sort of like an autoimmune disease, and rheumatoid arthritis, all these autoimmune diseases where the immune system is chaotic, aberrant, and it was very compelling. I mean, I could give you a list of 10 physicians, not off the top of my head, but I have, the references that have been using GC-MAF with great results. And some of our patients say that that's the one thing that they noticed that made a big difference. And we know that cancer is an immune suppressive disease, and anything that we could do to upregulate macrophages is important.
The debate continues, but that's yeah, that's a pretty powerful case for, especially with all the other physicians using it. And yeah, no, good stuff. Just definitely wanted to ask you. All right, so here's the big one I've been wanting to ask you for a long time. I think I heard you talk about this probably going back to the very first Truth About Cancer series, which came out right after my son got diagnosed. But this again, never-ending debate on the natural side of the fence anyway on sugar. Of course, we're all in agreement that eating a Snickers bar as a cancer patient or as anybody isn't a good idea, because that's just a huge blood sugar spike. It's artificial. It's going to go straight to the cancer cells preferentially, all that stuff. But then you talk about something like fruit
Hmm.
or juicing, and that's when everybody in the integrative cancer world has radically different opinions on everything. And your take on it has been, I've heard, I've heard explanations all over them, like on kind of the continuous throughout the spectrum. Like fruit is okay, but fruit juice is not okay because fruit has you're getting all the fiber with it and all this stuff. But you talk about the fact that a natural sugar is an L spin molecule, left spin molecule, whereas an unnatural sugar is a right spin molecule, and that the cancer cells preferentially or maybe only are able to take up the right spin molecule, but not the left spin molecule. The left spin molecule is just helping the normal cells. I want so badly for this to be true, because it would make things really easy. But yeah, I don't know. Can you go into that a bit? And where did this the literature come from that you pulled that from, or how did you get there?
Well, those are very interesting points and questions and thoughts on nutrition and sugar. I just finished a 1 week course at Harvard that I do every year last week, in October 2020. And one of the researchers at MIT and Harvard is saying that, the metabolism of cancer cells is not solely, as we know, on glucose, right? And my thought here is, Ryan, that cancer cells are intelligent. They have at least 10 biological hallmarks or characteristics that enable them to survive, well, first develop, survive, thrive, and metastasize. Now, in my next interview that we do, maybe in a number of months or next year, I will describe the 4 physical hallmarks of cancer. We know about the 10 biological hallmarks of cancer, and now studies out of these major, research centers that I'm privy to, they have found 4 physical hallmarks of cancer. Let me just tell you one. Let's say you have an orange and you slice an orange down the middle. What happens? Not much. But if you have a tumor and you slice it down the middle, what happens? Both sides continue to grow. And so this is a stress factor. This is a physical hallmark of cancer, just to give you a little insight on these four recently found physical hallmarks of cancer, which is very intriguing. So I say this to point to the fact that cancer is intelligent, cancer is a survival cell. If we deplete the body of natural, God made sugar, we are not going to kill cancer cells. I wish, like you said, I wish this is true. I wish it was that easy. Let's stop all the sugar, and the cancer cells are going to starve and go to bed, and that's it. But it's not that easy because the cancer cells will start to get their nutrients from fats or proteins or both of them. And so my thought, and this is not 100%, research and justified in clinical studies or publications, but my thought here is on common sense, on biblical knowledge, that what God put on this earth, what God put in this garden for us to eat, if we don't tamper with it, if we don't adulterate it, if we don't, mess it up, it is to give us health. An apple, a peach, a banana, a pineapple. I mean, all the enzymes in a pineapple, they've done a study where they say if you eat a banana a day, a ripe banana with the dots, it was decreasing the incidence of colon cancer by 40%,
Yeah,
decreasing
it's
the
got the tumor necrosis factor in there with the bananas. Yep.
right? Yes. And so you take all the micronutrients, you could have a whole Ziploc bag of pills and capsules and tablets, 2,000, if you will, and you have one apple. Where are you going to get the maximum health benefit? Not from these Ziploc bag full of capsules and tablets. You're going to get it from the apple. And so my thought with all this, and think about the Gerson diet, right? It's carrot juices. And Dr. Max Gerson knew that the sugar in carrot juice, a high glycemic index sugar or fruit, like the carrot, is not going to feed the cancer cells. And so, 4 or 6 carrot juices a day. I do believe, though, that like in life, everything has to be balanced, right? And so maybe 80% vegetables, 20% fruits, 70-30, something around there, because there are some phytochemicals in vegetables that we don't find in fruits, right? So berries, the work that has been done on berries, right, for so many good health benefits. So I'm not sure if I'm answering your question, Ryan, but the left spin and the right spin, that's another issue when you talk about the contrast medium used in the PET scan. They inject the
Yep.
contrast medium in the PET scan. That's called 2-fluorodeoxyglucose. Deoxy means it's a right spin sugar. And that's what the cancer cells in a PET scan absorb and light up. So when you get a PET scan, not you, but when someone gets a PET scan, the cancer cells are being fed by this right spin sugar, so it lights up, plus all the radiation. So it's like a double whammy effect on negative benefit for the patient. It is the Marquis test, and it does give you the SUV value, standard uptake value. That means how much of this molecule, this right spin sugar, was absorbed by the cancer cells. And the higher that number is in a PET scan, the SUV, the more active that tumor is. So it's important to know that in people that have a PET scan. So all in all, Ryan, I think life is about balance. Life is logical and makes sense. If we're Bible believers, why will God put in the garden something that we could eat when we're healthy? And now you have cancer. Don't eat that fruit. Don't eat that pineapple. That doesn't make sense. And I verified this with a Bible scholar who happens to be one of our long-term survivors with stage 4 pancreatic cancer. And I could say her name because she has allowed me to. Her name is Revi Litvin, and she lives in Southern California. She's going on her 8th year, if I'm not mistaken, 8th or 9th year with stage 4, after having stage 4 pancreatic cancer, meds to the liver. and she's fine. She's a Bible scholar, studied at Jerusalem University. She teaches the Bible from a Jewish and also from a Christian perspective. And I said, hey, Revi, does this make sense that God would put these fruits and all these berries and in the garden, and then we can't eat it if someone has cancer? And she thought about it for a little while, and she said, no, absolutely. It makes sense. So that's my take, Ryan, and I'm sticking to my story. And I leave it up to the patient because no one nutrition plan is good for everyone. If you eat a broccoli and it doesn't suit you well, then broccoli is not good for you. I do know, however, that the, there's something in God's food that we cannot get anywhere else. And then the people that are on the keto bandwagon and on the paleo bandwagon and all these things. Remember, cancer cells are very adaptive. As I said earlier, they're very smart. So every 3 to 4 months, rotate a little bit your nutrition. How often have we seen patients that are on a specific nutrition program and for like 6 months, 7 months, 8 months, and then the cancer takes off and they don't know why. And we don't know why, but we can surmise that nutrition has something to do with it. Cancer cells found a way to get around, what was sustaining it low with the keto or the Hope for Cancer nutrition plan, any of it. It's the rotation. Maybe we should go back to the seasons and eat, according to what's being grown where you live. And I'm Colombian. I'm not going to do really good with sushi, for example, right? uh, so yeah, it's quite a interesting topic.
Yeah, no, it's yeah, and that's the thing is I I I definitely go way more towards the side of you can talk about it you can talk about it from both ways, but from the God perspective, yeah, it's like, you look at a pineapple and it's got all that bromelain in there, which is a very, very anti-cancer enzyme, but then you're not supposed to eat the pineapple with the bromelain. It just doesn't, yeah, it doesn't jive. It doesn't. But then, yeah, and then even, from a purely mechanistic standpoint, it's like, this food's growing here and, we've evolved with it or whatever you want to call it. It's been around we've been eating it for a long time, and you would think that we would grow to just to get more and more benefit out of it, not for some reason that it's going to hurt us all of a sudden when and there's a disease come around. I go, but then I listen to some of the keto people, and obviously people do see some results, especially short term from keto. I definitely think of it as more of a targeted therapy than some sort of long-term lifestyle thing. And then so that does confuse me on that end, but yeah, I don't know. It's
And
can talk about that.
yeah, I'm looking at my notes here from my Harvard course, and it says, for example, here, cancer cells reprogram their metabolism to make more lipids. This is something that they're finding now.
Mm.
Cancer cells reprogram their metabolism to make more lipids. And the brain is a very lipid poor environment. Whereas the breast cancer cells that metastasize to the brain, this people have a lot more lipid synthesis. So there's the machinery, there's so much going on. And I think when we talk about all this, there's a lot that we're learning, a lot that we know, but ultimately, confusion is a big part of not having a favorable outcome. And nutrition is what confuses patients the most, right? Like you said, what should we eat, this or that or this? And so I think just make a common sense approach, see how your body is responding to your nutrition, talk to your doctor, talk to your nutritionist. We happen to have two excellent oncological nutritionists at our centers, one in Cancun and one in Tijuana. So it's it's individual and it's personalized as well.
Well, I have about 10 more questions written down, but this interview is getting a little long in the tooth and this connection is getting a little bit spotty. Hopefully we can piece something together good for folks. But let's plan on a round two sometime sooner than later. And I'll ask you all the random stuff that I didn't get to this time. How's that sound?
All right, sounds good, Ryan. Always a pleasure. You know, the more you and I and others can provide information and education to folks so that they can make a more, well-rounded decision. That's what we're doing, right? And eventually, we have to be responsible for our own decisions based on information and ultimately, I must say, based on what the Holy Spirit is telling us, because we could talk about, right spin, left spin, we could talk about all this, but ultimately, where is the Spirit guiding you? And, should I go to Hope for Cancer? Should I go to Germany? Should I go here for treatment? Sit down, be still, go into prayer, and allow the Spirit to guide you, and that will be the right decision.
I love it. I
Mm.
love it. Yeah, it's certainly guided us a whole lot in our journey. That's for sure. And the more we listen to it, the every time we like kind of second guess things and like, well, that seems like the right thing, but this is the more logical thing, so we'll do this. And that always turned out bad. So
Fire. Yeah, that's for sure. Well, thank you so much, Ryan.
yeah, Dr. Tony, you wanna let everyone know where to follow up with you? Hope for Cancer. Remind them about the book again. All that good stuff.
Surely, Hope for Cancer. It's hope, the number four, cancer.com. And we have a great team, staff that will, talk to you if you're interested. And this has no fee. Just reach out to us, send us your medical records. Our staff doctor will review it, give you some recommendations, and go from there. And in the book, Hope for Cancer, Seven Principles to Remove Fear and Empower Your Healing Journey. You could go get it from our website or from Amazon. And it is in Japanese, so you could get it in Japanese as well. And next year we'll have it in Portuguese as well and in Spanish. So it's part of what we do, hopeforcancer.com. And maybe you could also watch a reality show called 8 Days that it's now released. It was on WGN America, nationwide TV station in the US. And now it is available on our website. It's called 8 Days, and that tracks the story of first-time patients and also patients that were coming from follow-up. When we shot this, Ryan, in August of 2019, the first thing I told the producer, whose name is Charles Maddox, he's actually the nephew of who's that singer in Jamaica man, the famous singer,
Bob
uh,
Marley.
Bob Marley. Bob Marley. So Charles Maddox, the producer, is the nephew of Bob Marley, and I told him, Charles, when we make this reality show documentary, it has to be real. No exaggerations, nothing like, we would think of a reality show. And that's what we did. So you could follow the story of five patients and their treatments, their ups and downs. And it's on our website for you to watch as well.
I love it. Yeah, I remember seeing that, on Facebook or whatever, just the shooting of it,
Mm.
but I didn't hear about where to see it afterwards. So no, I'll definitely put that on the watch list for me for sure.
All right.
Good deal,
Okay.
Dr. Tony Jimenez. Always a pleasure, and yeah, thanks so much for coming on. You take care out there.
Thank you, Ryan. Thank you so much, and blessings to everyone.
There you have it, the one and only Dr. Tony Jimenez. Always a very good and informative time talking to him. Like I said while we were recording, I had a ginormous list of questions his book prompted, and we made it through like an eighth of them. The spotty connection we were recording on, even after we had to come back a second time to finish, definitely didn't help. So we're certainly going to need to get a follow-up session going soon. As always, on the sternmethod.com/Tony-Jimenez, you can find all the notes, timestamps to all topics discussed if you want to go back and just listen to one part again, which is a new feature I'm really excited about. Links to all resources mentioned, which, by the way, when you make a point to go to our site and click those links that you heard about, it really does help us to keep what we're doing going here, such as getting help to do timestamps and helpful things like that. And if it is a product of some kind, we're always working to link to the very best possible price on that note. I was very glad to hear Dr. Tony confirm my general feelings on red light therapy in regards to cancer. I definitely understand both sides of the issue, but it just seems like the more doctors I talk to about these various, well, if it helps regular cells, it's going to help cancer cells, concerns that get brought up, particularly surrounding the mitochondria, they just don't really hold up. Not saying there's no concern on anything, but I'm glad Dr. Tony could bring some sound science and experience to this issue in particular. I'm going to need to do a little more digging before attempting to convert my whole sauna to near infrared, as I've got a lot of conditioning telling me that far is the most beneficial, and our sauna does have a bit of near in it for that matter. Speaking of science, on the sugar left spin versus right spin thing, and do cancer cells only absorb one or the other, I do wish we could have dug in more on the research behind that one, as sugar is probably the most debated issue in cancer. But alas, we were going through a particularly rough patch on the connection and it just didn't happen. That said, I totally agree, it just doesn't make sense from a nature or creation point of view to have all these anti-cancer compounds hidden inside something you're not supposed to eat when you have cancer. And do see people doing quite well with that philosophy, but on the other hand, I certainly see a lot of practitioners I respect getting great results having their patients restrict carbohydrates and whatnot as well. So the debate continues, I suppose. And I do plan on having two opposing sides of controversial issues on the same interview going forward for that matter. Speaking of plans, a couple things to note before I get out of here. As mentioned, keep your eyes out for an entire new show from us, which will be called The Great Work of Healing. This show, The Anti-Cancer Revolution, is of course about cancer and what we can quote unquote prove. The Great Work of Healing will be more exploratory, for lack of a better term, and not necessarily cancer specific, but a whole lot of stuff pertaining to healing that I can pretty much promise you're not hearing on many other health shows. If you're not already on our email list, you should go to thesternmethod.com to get on it, to be notified when those episodes start airing within the next few weeks. There is a bit of a change to this show as well. We had such a tremendous response from how we went about the last online conference, in that it was composed almost entirely of comprehensive medical conference style presentations rather than conversational interviews, that we're going to be featuring a lot of this type of content here on this show as well. These will be presentations that have been already given and recorded at other medical conferences, or the best ones that you may have missed from ours. Really think you're going to like it. Stay tuned for that. Few other really cool things in the works I know you're going to be excited about, but this outro is definitely long enough, so we'll save it for later. Very glad to be back. Glad to have you with us as always. I'm Ryan Sternagel of The Stern Method, and if you're going through cancer, just keep going.